There's three principal operations that we offer. The first is the laparoscopic adjustable gastric band. The second is called the laparoscopic vertical sleeve gastrectomy. And the third is called a laparoscopic Roux-en-Y gastric bypass. We tend to tailor the operation specifically not only to the patient's history, both medical and surgical, but also what their goals are, what their willingness and or desire as far as specific lifestyle changes and requirements are concerned for the operation, and perhaps most importantly because it's sort of like clothes. Not every style of clothing nor every size is right for every individual patient. And so we have to truly make that decision together with the patient to determine how we can best get them where they want to be, both with regards to their weight, but most importantly with regards to improvements in their quality of life and improvements in their overall health. One of the major changes in bariatric surgery over the last 20 years has been the shift from open, large incisions to laparoscopic procedures. This has decreased the risk of complications, including pain and even death in patients substantially. In laparoscopic procedures, we do the same operation that previously took an 18 to 24-inch incision and is performed through 5 to 6 small incisions under an inch long each. Using long instruments and cameras and carbon dioxide to inflate the abdominal cavity, we can actually move the bowel around and perform the procedure. In the sleeve gastrectomy, we free up the stomach from its attachments all the way along its long outer length. And from there, we actually drop a gastroscope or endoscope down into, drive it directly along the esophagus into the stomach and place it along the lesser curvature of the stomach. Now, with the stomach on its larger curve completely freed up, we can resect that portion or remove it entirely with a stapling device, leaving the patient with a stomach, once again, that's about the size, length, and shape of a common Chiquita banana. That actually gives them the small volume of food that they would eat prior to feeling full and having a great sense of satisfaction with their meal. We have 5 basic rules that our patients follow, and those really center around the lifestyle changes that we request that they make and really are necessary for them to have long-term success. And those include eating your protein first. You're eating a smaller volume of food, a smaller number of calories. It needs to be the best calories that you can possibly get and the best quality of nutrients that you can have. It's very important for you to be able to heal and to maintain good tissue structure. That's why eating your protein first and the small amount of food that you're eating is important. The second is not snacking. Well, that's every single diet that someone's been on. The problem is that you're hungry between meals, and that's what leads to people snacking. These operations are not magic. They are tools. They are tools that help you achieve weight loss and to maintain that weight loss. And one of the ways those tools work is by helping you not be hungry between meals. That avoids that drive to snack. The third is to drink that large amount of water. And as we've already talked about, it's important to stay hydrated, especially patients who are recovering from bariatric surgery and are going through the process of losing the weight and keeping it off for the rest of their life. The fourth is exercise. And a lot of people don't want to talk about that. But weight loss is a very simple math problem with a very difficult solution to find. And that is that a patient must take in or eat fewer calories than what they expend. The farther that you can actually push that teeter-totter, if you want to call it, so that you're taking in significantly fewer calories through diet and lifestyle change related to the bariatric surgery, and pushing the amount of energy that you're expending in exercise every single day, you can have dramatic improvement. The last is that patients must take vitamin and mineral supplements every single day for the rest of their life. One of the reasons why I got into medicine was to help people change their lives. The main reason I got into surgery is there's no other field, in my opinion, that gives you the opportunity to do that directly. To see patients come to me and have the opportunity to fly across the country and see their family for the first time in 10 years, to go on that trip they've always wanted to, or to just not have to take diabetes medications anymore, it's absolutely spectacular. In fact, most times I'm not even able to recognize the patient when they come around the corner. And they have to reintroduce themselves to me, which oftentimes leads to me having to apologize because I can't recognize them.